Shipley is a small industrial and residential town situated 3 miles northwest of Bradford. It has excellent transport links with trains running frequently to Leeds, Bradford, Skipton and Ilkley. It's one of the oldest towns in England as it appeared in the Domesday Book in 1086. The Old English translation of Shipley is sheep meadow.
There are over 15,000 residents in Shipley. The last recorded birth rate was 11.4 births per 1,000 people.
From the health census of 2011, over 45% of Shipley's residents reported being in very good health, which is higher than average in the Yorkshire region. The number of residents identifying themselves as having bad health is lower than the national and regional average. The World Health Organization defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity.
Hooper et al. 2011 want to add to this definition by saying health is also the ability to adapt and self-manage in the face of social, physical and emotional challenges.
So what influences our health? Beliefs,
Gender,
Economics.
Politics.
There are many belief networks in Shipley, with over 50% of Shipley's population identifying themselves as Christians, 9% Muslims, and over a third of the population state that they do not have a religion. Predominantly, the main ethnic group in Shipley is white British.
There is a relatively equal split of male and female residents in Shipley. It is predominantly governed by men, however there are active women's groups in local areas. There are 3 GP surgeries that have midwife-based services.
Shipley's primary healthcare is funded by Bradford District's clinical commissioning groups. The next steps are to reduce premature deaths caused by cardiovascular disease, improving the patient's experience of care by working in partnership with community and voluntary agencies, and encouraging people to live better lives within the community to keep people out of hospitals.
The political governance of Shipley is led by a Conservative MP who has been in office since 2005. In Bradford Council, Shipley is represented by 3 councillors from the Green Party who support voluntary and community-based organisations such as the allotment working groups and local neighbourhood forums.
In order for health to flourish in a society, it needs social capitals to survive. According to Robert Putnam, social capital is how a society is organised through networks, which then develop trust and shared norms within a society. The higher the social capital, the more effective the society and coordinated in their approach to life. Social capital, according to Putnam, comes in different forms. Bridging, which is the linking of groups and sharing of information across social divisions. And bonding, which is reinforcing people's identities within certain groups and showing loyalty and coordinating action between them, such as neighbourhood watch schemes. Hendry et al. Conclude that communities with high social capital are better connected and therefore can influence health services together. By lobbying for healthcare together, it increases patient choice and opportunities to engage with healthcare providers. This networking then reinforces the trust and bonds that have already existed in communities to make them go from strength to strength.
Who contributes to Shipley's social capital?
We started by looking at the ISIS project, which is a charity in Shipley that supports women recovering from mental health trauma. Their manager explains what they do at ISIS.
We provide support for women in recovery from a range of mental health problems. We also have a creche for under 5 so that mums can engage in the activities and get better. We try to listen to what service users want, and we provide courses such as confidence building, arts and crafts, Pamper Me, pampering groups, cook and eat, a range of different topics really. We do feel that we provide a really valuable service which actually is a preventive service. It keeps women out of hospital. It reflects a very big saving to the NHS by helping women recover. And we also network really well here with partner agencies to provide holistic services for our service users.
One of ISIS's partner agencies is Healthy Action Local Engagement, or HALE. HALE are an independent charity in Shipley who work with people of all ages and backgrounds to improve health inequalities. Their communications worker explains why Shipley needs HALE to contribute to its social capital.
So I really believe that Shipley does need HALE. We work very closely with other groups in Shipley, and we do try to work in partnership with as many organisations as we can within the Shipley area. We run a number of different activities and work around the key themes of nutrition and exercise, alcohol awareness, sexual health, mental health and wellbeing. And we also do a lot of mobile outreach work on our bus, which is a fully kitted out bus with a kitchen on board and a private consultation room. We work with all ages, all backgrounds, men and women, and we do try to fill the gaps in provision that other services don't quite reach. So I do think without HALE there would be a lot of people who fell through those gaps. We contribute to Shipley Social Capital by things like the networker scheme, which I mentioned, by linking groups in together, by bringing new people into groups, and also if there is a gap and we feel that we've got a group of clients who have nowhere to go, then we will try and set up a group that addresses that issue, which I think is another thing that makes HALE quite unique. So one of the services we run is the catch-up service, which is a midwife drop-in at the Kirkgate Centre, right in the centre of Shipley. It's easy for people to get to by bus, should they need to, and we're able to cover clients from quite a wide catchment area there. People can come in before they have their baby, see the midwife, with no appointment, which is really quite unique and really, really helpful. And of course they can come after they've had the baby as well. Any parents of young children welcome to come along, see the midwife or the health visitor. We also get representatives from the job centre in, and we can offer loads of help and support about antenatal and postnatal care, breastfeeding support. Yeah, we've got our networkers there, so not only do they know about things from the networking point of view, but also they are trained peer mentors for breastfeeding. So we can help with the breastfeeding side of things, weaning tips for the older children, older babies, and just general access to health information, smoking cessation, and help people link into groups as well. So we can offer quite a rounded support for the whole family.
The catch-up service is hosted by the Kirkgate Centre.
The Kirkgate Centre is a community centre in the heart of Shipley that runs over 1,500 events every year. Their development manager explains the Kirkgate Centre's role in contributing to Shipley's social capital.
It's very varied, so we have almost all the sessions are run by local residents. That's really important to us. So most things here happen because people want them to happen and are paid. And that extends from lots of exercise classes and things like that you expect to see in the community centre. We've got markets, we have a community cinema, we have gigs, we have lots of other people's projects. We have midwifery drop-ins, and it's cradle to grave really. So when we started this, one of the things we wanted to happen, we've been in lots of similar projects, and they've never really been that satisfactory because they tend to create a user group, and that tends to have its own particular characteristics. So when we started this back in 2008, we said we want it to feel really open. We want anybody in Shipley to feel like there's something there for them, that they can come in, and that it's an open door. So when we get involved in a conversation with people about what they want to see happen, and then we can look back and think, well, what's changed from when we started that conversation to now? And normally what's changed, hopefully, if things have gone well, is you've seen social capital develop, so people feel more confident. They've met other people that enables them to do things. They've got skills, maybe got some money, maybe they're collaborating, so there's projects for them. And that's really what we're all about, is trying to make Shipley a strong, healthy, vibrant and place to live, a good place to live. It is. It was already a great place to live, but as one of our little mottos is making Shipley an even better place to live. There's always room for improvement, so we hope we contribute to that.